Bismillahirrahmanirrahim. Today, my topic is the from the dental pharmacology, which is the desensitizing agents for the tooth sensitivity. Basically, the dentin hypersensitivity. These agents are used to reduce the dentin hypersensitivity, and dentin hypersensitivity is the most common problem all over the world. And there must be some stimuli which trigger the hypersensitivity of the dentin, which may be chemical or thermal or maybe mechanical. So, tooth hypersensitivity, uh, there must be some reasons, and first I will explain first reason, which is the exposure of the enamel, and the enamel will expose due to the chemical erosion during the chemical reaction occur within tooth or due to the mechanical wear, maybe mechanical wear. And the second reason is the exposure of tooth surface. And the exposure of tooth surface occur due to maybe due to the improper brushing techniques or due to the chronic periodontal diseases. So, um, the ideal desensitizing agent properties of ideal desensitizing agents are that it should be non-irritant, and it should be non-toxic, and the ideal desensitizing agent should act rapidly, and the its effect should be long lasting, and it should be easy to use, the most important, and it should be pain free. So now I will explain about the desensitizing agents one by one, and the first one is the agents occluding dentinal tubules to reduce the hypersensitivity of the dentin. So the compounds which can used um, for this process maybe can be a stannous fluoride or the potassium nitrate, and there are many more others. And there is a specific mechanism of action of these kinds of agents, which act by the process of hydrolysis or the process of the oxidation, and through these two processes these agents from the insoluble metal salt on the surface of the tooth, and these penetrate the dentinal tubule to occlude these tubules. The next one is the penetrating protein agents, and these agents work by the salting out process. Salting out process is basically the use of the different salts in the compression of the um, salivatory layer. Basically, salivatory layer is the solvent interface of any chemical compound around the eye. So these this process work by the compression of the salivatory layer and help in penetration of protein on the tooth surface, and these include the ammonium sulfate and the silver nitrate. The next one is the tubule sealants. Tubule sealants work by sealing the dentinal tubules to reduce its hypersensitivity, and the agents involved in tubule sealants is the HEMA, which we can call as the hydroxyethyl methacrylate. And the most it's an important process, restoration processes, which we can use to decrease the hypersensitivity of the dentines by using the glass ionomers, by using the fluoride varnishes, many other compounds, it may be the oxalic acid, and many more. And the first one is the most smarter way for today's use, and it's a lasers use of lasers. It's an expensive process, but it is less time consuming, And the most important two laser processes are the erbium YAG laser and gallium L arsenide laser. Now I will explain about the obtendents. Obtendents are basically the compounds uh, which we can use. The medical, first of all, I will explain about its medical definition, which is blunting irritation or lessen pain. Its verbal meaning, and it is used to decrease the hypersensitivity, and it also has the specific mechanism of action. So first, it will act by the paralysis to paralyze by paralyze the sensory nerves, and the compound in these are the phenol and methanol. The second process is the protein penetration mechanism of action, and the third mechanism of action, its way, is the destruction of the nerve tissue. Destruction of the nerve tissue by using the absolute alcohol. So there are the advantages and disadvantages both of the obtendants. And first, I will explain about the advantages of the obtendants, um, which is that it penetrate dentine very sufficiently, very sufficiently, and obtendants are free from pain during its usage, and it doesn't stain dentine yellow or any other color. And the disadvantages of the obtendants are very dangerous and very rigorous, that it causes the pulp shrinkage. It's really bad. And the second one, that it causes the formation of secondary dentine. Now I have explained till now the desensitizing agents and obtendants, is advantages, disadvantages, and mechanism of action. Now I will explain about the function of individual desensitizing agent one by one. There are many desensitizing agents. The first one is the alcohol, and alcohol is the easily penetratable. Its penetration is really easy, and it does not stain teeth. The second one is the benzyl alcohol. Benzyl alcohol, its mechanism of action is very particular, that it acts by producing the dehydration. It causes the dehydration of the tooth structures, and the most important, that it has an aesthetic effect when it reacts with chlorine in 1:2. And the third one is the phenol, which we can call as carbolic acid. Phenol is the aromatic organic compound, and it is a protoplasmic poison. This is the most important point about the phenol, and its action is very rapid, and the effect of the phenol can be increased by reacting it with the potassium hydroxide and glycerin, and the worst effect is that it darkens infected dentine. The next one is the chlorobutanol. Chlorobutanol is also a volatile compound, and it also stains dentine. And the next one is the methanol and thiamol. These are the volatile oils and act in the same way as the chlorobutanol. And methanol and thiamol stain dentine yellow in color. And the last one is formaldehyde. Now here we are end with it. Thank you so much.